This is the time I get to spend with you guys and answer all of your plastic surgery questions. So I hope some of you kind of sent them through the little box there. So we'll be happy to answer those. But before we get into that, I just want to really quickly go over what I like to call our out-of-town playbook, all right? And the reason for that is that actually the majority of our patients actually come from out of town, meaning they're not from Miami. So they can come, of course, from different areas in Florida. Orlando is super popular, but of course, actually they come from all over the U.S. So I think we've had patients come from just about every single state in the U.S. Actually, I think the last time we checked, it was 49 states. And so people are coming, as far out as Hawaii. And then we have people coming in from different countries, Canada, Europe, even African countries. We've had patients come from Ghana, Nigeria, certainly, the UK and Europe. And like I said, we've even had patients come from Australia. That's crazy, but it's true. So we have everything that you need. If you're an out-of-town patient, it can be scary, right? Because you're like, oh boy, I'm going to go over there, I'm going to have surgery, where am I going to stay, who's going to take care of me? All these questions come up, right? And so what I want you guys to know is that we have everything already kind of all lined up for you, all right? We are able to take care of all of your needs. We are fully prepared for our out-of-town patients to make the journey as seamless and easy as possible, okay? So, first of all, how do we start, right? So we start with virtual consults, right? So you're out of town, you're not going to be able to drive to Miami for an in-person consult. So we start with our virtual consults, and we do that. We can do a virtual consult online through our website, or we can also, if we have your contact information, set up a video consult, all right? So the virtual consult is online. It's going to be through our website. The website is www.pureplasticsurgery.com. Okay? So you simply go to our website, www.pureplasticsurgery.com. You're going to find a place there where it says, start your journey, or there's even an area where it says virtual consultation. And through there, you're going to be able to fill in a questionnaire and even send your photos. And so that information and those photos come in, and then I'm able to evaluate them. I can create a treatment plan for you, and then I can have my coordinator reach out to you. Okay? So that's the easiest way to get started, and I recommend for everyone to start that way, so that we can get your information and have my coordinators get in touch, and they can take it from there. Once the coordinator gets in touch, if you want to do a video consult, so kind of us on the video face-to-face, that's available as well. That does have a cost, okay? The cost of that is $250. Now those $250 will go towards your surgery if you decide to book. So it's not additional, in addition to your surgical fee, okay? So it goes towards the surgery. So you're not really losing anything there, okay? The virtual consults are free. These are $0, okay? $0. All right. So we've done the consult, we've come up with the treatment plan, we're getting you all set up, and then the next thing, I didn't actually write it here, but the next thing is, now we gotta get ready for surgery, right? And so we have an entire pre-op department that is in charge of making sure that you are ready for surgery. And so they're gonna start reaching out to you anywhere between 45 to 60 days before the surgery, and they're gonna tell you step by step, very, very easy, everything that you need to do, everything that you need to know in order to prepare for surgery. They're going to tell you what labs to get, your EKG, if you need it, your chest x-ray, your medical clearance. They'll let you know if you need any other special clearances based on that information. They're going to let you know what supplements to take, such as vitamin C, folic acid, and iron supplements. They're going to let you know what stuff to stop. Okay, what are the things you can't do? For example, you can't take oral birth control for 30 days before. You shouldn't be taking Adderall or phentermine 30 days before. You should stop your Mounjaro or Ozempic at 30 days before. So they're going to give you all that information, all right? And it's all going to be very, very easy to follow. So that's what kind of happens between that and then actually getting here for your surgery. But once you get here, we can take care of everything for you. So question number one, where do I stay? Well, guess what? We have a hotel package. We can hook you up with the AC hotel, which is about 7 minutes away. and also adjacent to the Dayland Mall, so it's really, really cool. And there are partners, and they they know how to take care of surgery patients, and they have special rooms for surgical patients, okay? So we can hook you up with a place to stay. Well, next thing you're gonna ask, well, how do I get to the clinic back and forth? All right, well, if you stay at the hotel, we have transportation for you. So the transport will take you from the hotel to the clinic, back and forth, for all your pre-op appointments, your surgery day, and your post-op appointments, okay? Now, keep in mind, the transport is strictly for commuting between the hotel and the clinic. As of right now, maybe in the future we will, but as of right now, we cannot provide additional transport, like for example, the airport, or like just random trips you want to take, or going to like the Faja store, stuff like that, okay? But we do provide the transport there, so very, very easy. Next thing, you're gonna ask, well, who's gonna take care of me? Well, yeah, you want to bring a caregiver, but if you want to have someone, you know, who's actually done this before take care of you as well, you know, with your caregiver, so your caregiver doesn't feel so much stress and pressure, well, we can provide you post-op care with our partners at Med Miami. And so these are MAs and nurses that have actually done this a ton of times. They know exactly what to do. They know exactly what to look for. And so they can be there with you in the hotel. Isn't that convenient, right? So they're there with you in the hotel, and so we can hook you up with that. Next thing you know, you're going to need your medications. We got that all taken care of for you. We got a concierge pharmacy, so when you come here for your pre-op, all your medications are going to be in your little goodie bag. You don't have to run around all of Miami trying to find, you know, Percocet, and you know, running into the 5th CVS and the 5th Walgreens to try to find all that stuff. We have it all here ready and set up for you. Super, super easy. You don't have to do anything, okay? We got your meds, and then the last thing is, of course, your massage, right? Oh, who's gonna do my massage? Are they gonna come to me? Am I gonna go to them? Blah, 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 right? Again, got that taken care of as well. We have a great massage therapist, Bestie, Jeannie, or Jessica, and she can do your massages either here in the clinic, or she can go to the hotel. She loves doing the massage at the hotel, so you don't even have to move for your massages, all right? So Bessie Jeannie can definitely go to your hotel and do your massages there in the comfort of your own room, okay? So, bottom line is, we love our out-of-town patients. In fact, the majority of our patients are out of town, and we can take care of absolutely everything for you, so you can have like the lowest amount of stress possible as you embark on this journey, all right? So, I'm happy to answer questions about this or any other plastic surgery question you may have.
Thank you. Yeah, we have a lot of questions, so I might have to start the rapid fire.
All right. Oh, we're going to start with rapid fire? Okay. All right. All right. We'll try to get to as many as we can.
Yes.
All right.
Yes.
Here we go.
Okay. Are you able right now, do you know the prices for the packages?
So I don't know them myself top of my head, but yeah, certainly like reach out to us, give us a call. If you want to give a call as well, I'll put the number up here, 305-230-4326. And then yes, you can speak, the person you can speak to is either your coordinator or Roxy, and they'll be able to give you all the information regarding you know, the hotel package with the transport and everything else.
I already had a BBL and tummy tuck, but I still want more of an hourglass figure. What else can I do?
So the one additional thing that you can do that you haven't done yet is change the bony structure, right? So if you had a BBL, that means that you remove the fat. If you had the tummy tuck, that means you remove the excess skin and you fix the muscles. But what's the one thing you haven't fixed yet? Or changed, let's put it that way. That's your ribs, right? So if you want a smaller waist and you've done all that already, then my recommendation for you would be to do a rib remodel or rib sculpting procedure. It's like the procedure that I'm like in love with right now. We actually have 4 of them this week. And that's because people really trust us with this procedure. We're pretty much, you know, this is our specialty here, or my specialty in particular. And so you could come in and I could go ahead and sculpt or remodel the 3 lower ribs on each side. We can bring those ribs in and shrink down the waist.
What do you think about butt implants? Can they look really good?
Okay, so butt implants have gone through quite a bit of an evolution lately. Honestly, it's not my first choice. Like if you have your own fat, that's the best option. So do a BBL, right? Do liposculpture and fat transfer. However, if for whatever reason, you know, you don't have enough fat, you're very, very thin, your BMI is very low, then, you know, you may want to do a buttock implant. But what's changed and what makes them more natural looking today, as opposed to in the past, is that now people are using smaller implants. So just to give you some of that projection, and then still using whatever fat you have to soften it up and to like to soften up the edges kind of around the implant and to put a little bit down into the hips so that it looks a bit everything more natural. Sometimes even putting a little fat above the implant area as well. And so with that combination of using a bit of a smaller implant but with some fat transfer, you can get a very natural look.
For Canadian patients, would you recommend coming 7 days before for blood work, or go somewhere in the States 3 weeks before surgery?
So yeah, well, in terms of those two, you have the option really. So unfortunately, the reason why you have to do this is because of some of the rules that we have here in Florida given to us by the Department of Health, which state that the lab exams have to be done here in the U.S. Okay, honestly, why does that rule exist? Don't ask me. I didn't make the rule. I don't think it should exist. I think they know how to do labs in Canada just as well as they know how to do them here. But it is the rule, and we gotta abide by it. So the whole point is that we just need the labs to be done in the U.S. Okay, so it can be New York, it can be Miami, it can be done, within that 45 or 60-day window. I'm sorry, that is it 30 days? Well, whatever. Our pre-op team will let you know. But it doesn't have to be just before surgery, right? It can definitely be within at least 30 days of surgery. So if you prefer to go to New York 3 weeks before, get all your labs done, as long as we can get those results here in time, you're good to go.
Thank you. A few comments. Can you move over because people want to see the number?
Oh,
there we go.
There we go. Okay. 305-230-4326.
Thank you. If you have a teeny belly flap, can you get lipo and the skin will go back?
So, okay, let me rephrase the question, right? So, let's talk about skin laxity or loose skin. So, loose skin can be in different degrees. You can have mild, moderate, and severe. When you ask me a question like if you have like just a teeny bit amount, then I'm thinking that you maybe have just some mild skin laxity. If you have some mild skin laxity or loose skin, then typically what I recommend for those cases is to add a skin tightening procedure such as Quantum or J-Plasma Body Tight. Okay, and so if you're adding those, then that's going to help the skin retract, and it typically works well for those patients that have mild or even like low moderate loose skin. Now if you have high moderate or severe loose skin, in that particular case those devices are not able to provide enough skin retraction and you're going to need a tummy tuck.
During the tummy tuck, do you also repair the oblique muscle?
So the oblique muscle doesn't typically need to be repaired per se. So the reason we call it a muscle repair for your rectus muscles, which are the ones that come up and down like this, is because they typically get very, very stretched out and separated with the pregnancy. So those we'll bring back together and tighten up. Now what we can do though is what's called a triple plication. And sometimes we do need to do this to get the flattest tummy as possible and to like also kind of cinch in the waist from the inside, kind of like an internal corset, if you will. So if you're looking at a tummy, so we're looking at a tummy, right? That's the arms up here. So the muscle repair, and then this is the breast there. So muscle repair goes from top to bottom here in the center all the way. Okay, but if we want to, and this can affect the obliques, so the obliques are bulging a little bit, then we can do another kind of plication out here on the sides. That's what's called a triple plication, and that's what's going to help any bulging out a little bit out more laterally where the oblique muscles are.
Thank you. All right, so many questions. How many appointments do you have to attend after my BBL?
All right, so that's a good question. So for our out of town patients, right, you have to be in town for a minimum of 5 days post-op. That's the absolute minimum. You cannot fly back home until after post-op day 5. Okay, so that means that you're going to have your post-op day 1 visit, which is going to be a video consult because we don't want you moving around so much the day after surgery. Post-op day 5 is going to be here in person in the clinic. And then after that, if everything looks good, then you'll be cleared to go home. And then from home, the next official visits are going to be, they can be virtual, it would be a video consult, and those can be at 6 weeks and at 3 months, okay? Having said that, we're always here for you. We're here for you at all times. So you need absolutely anything, you just reach out to us and let us know.
Thank you. So, All right, so do you perform skinny BBLs?
Definitely. Not only do I perform them, I think I'm one of the best at it, and I have my own signature skinny BBL, which is called the South Beach Butt Lift, where we're doing a skinny BBL with minimum incisions that are all extremely hidden and not visible, even when you're wearing a tiny bikini out on the beach.
So the same person earlier that you recommended rib remodel, she asks, don't I need my ribs?
Well, yeah, but that's the difference between so rib remodel is not the same as rib removal, okay? So those are two different things. So rib removal or resection is where you are taking out ribs. Rib remodel or rib sculpting, some people call it rib X-scar, that's another name, or B-waist, Barbie waist, or wasp waist, has many names out there. But the whole point is that you're actually not removing ribs. What you're doing is repositioning the ribs. So if your ribs are flared out this way, causing you to have a large waist, I can make a controlled fracture where I then I can mold the ribs and bring them in. And so the waist, which is now this big, now becomes this big, okay? And so I can sculpt the ribs in a way that's gonna make your waist smaller, but your ribs are still there. They're still there, they're still protecting your organs, they never left.
Is it safe to have cosmetic procedures with sleep apnea?
So in general, yes, but we're going to need a few things. We're going to need a clearance from your primary care doctor. And typically we have our patients that have sleep apnea, they have to bring their CPAP machine. So if you're someone with sleep apnea that uses CPAP at night, you have to bring that with you.
Thank you. Do you do BBL reduction? If yes, how many have you done? P.S. I love your work.
Yes, awesome. So that's a great question because not everyone does this, right? So it's actually a very good question. Very few places are actually, I would say, experts in BBL reduction and reshaping. But we are. It's one of the things that we do down here. I've probably done at least 50 cases of these. Of course, certainly not as popular as BBL. I do 400 BBLs. And about 400 BBLs per year and about 50 BBL reduction or reshaping cases a year.
Thank you. I'm anemic and I have asthma. Can I still get a BBL with aggressive lipo?
So anemic and asthma, okay. So the question is going to be how anemic, okay? So there is a minimum hemoglobin. So you have to have a hemoglobin, which is your hemo level, has to be greater or equal to 12. Okay? So, if you're anemic to the point that your hemoglobin is less than 12, then at least for me, you're not going to be a candidate. Okay? But if we can get your hemoglobin to at least the 12, then yes, you would be a candidate for BBL.
Hi, doctor. I need a second opinion regarding my right breast. It feels hard and sits higher. The MRI showed fluid with some blood around the implant.
Oh boy.
I'm planning fluid aspirations. What are your thoughts?
My thoughts is that you need a surgery. That you're having some capsular contracture and it seems like you're having, either a seroma or some sort of delayed hematoma bleeding around the implant. So the first thing is, continue the path that you're doing. Have them remove the fluid. Make sure they send that fluid for something called cytology, to make sure that they rule out something called a ALCL. Okay. So breast implant associated ALCL, which is a rare, extremely rare type of lymphoma. You most likely don't have it, but they should check for it, okay? And then once you've done that and you get your results and they'll probably be negative, then I recommend that you see a plastic surgeon so that you can have the implant and capsule removed. That's called a capsulectomy. Implant exchange, and implant exchange washout.
She says, X-ray showed sclerosis on my T4. It was an incidental find. I'm going for an MRI. Should I be worried?
Who's that? Same patient? No, different patient.
Oh, different file. Sorry, mixed them up.
Oh, okay.
Okay, so we have a ton here.
Yeah.
So the sleep apnea, there's a follow-up to that.
Mm-hmm.
What if you have sleep apnea but don't use your CPAP anymore?
Okay, then that's fine as long as you get your medical clearance.
What's the difference between lipo 360 and aggressive lipo?
There's really no difference in the sense of like what it is. It's just what the surgeon does, right? So lipo 360 means that you're doing lipo in the entire trunk. That's what 360 means. 360 is all the way around the trunk. That means that the entire abdomen, the entire flanks and waist, and pretty much the entire back. Aggressive means just how aggressive the surgeon is. I don't necessarily like the term aggressive lipo because you don't want to be overly aggressive, right? Yes, you want to remove as much fat as possible, but you want to do it in a way that is safe for the patient and for the skin of that patient, right? So if you're overly aggressive, then and the skin is too thin, you're going to run into problems of potentially what's called lipoburns or fibrosis or other issues. So you always want to leave at least 1 centimeter of fat beneath the skin to have the best result. So I would be very careful if you go for quote unquote aggressive lipo in that sense, because if they're overly aggressive, then your skin can suffer, or you can bleed too much and then require blood transfusions and stuff like that.
Thank you. Do you perform a skinny BBL, and if you do you use a sonogram when you perform it?
I definitely perform skinny BBLs. Like I said, I have my own signature one called the South Beach Butt Lift, and yes, I am one of the pioneers in ultrasound guided BBLs. I've done this since 2019 and have over 2,000 ultrasound guided BBLs under my belt, and never had a single incidence of fat embolism or death.
Thank you. Does the Smart Tuck come with Vaser lipo?
The Smart Tuck does typically not necessarily typically we don't need to use the Vaser for that, but it can if you like, and we do lipo all along the entire flank and the waist and the axillary region here. That's all going to be included with your Smart Tuck.
I just got my boobs done 6 months ago and they're still very far apart. Is there anything I can do?
At 6 months, I'm not sure that there's a lot that can be done at that point in time. I think I would just make sure that you're wearing a nice supportive bra, especially when you're going to be active. And you may even consider kind of wearing that at night as well to try to keep the implants more centralized, and see if that helps doing that for a few months. But certainly if you get to the 12-month mark, so if it's been a year and things are still pretty far apart, then you may need some sort of kind of pocket revision for that.
Is it better for you to get a lipo 360 done before tummy tuck?
No. I always recommend do your tummy tuck first. Always. Okay? You want to deal with the skin and the muscle first, and then you deal with the fat. Think of it that way. So do your tummy tuck first, and then come back 3 months later for your lipo 360.
Let's see. All right, let's see if I can read this.
Okay.
Can a person who has had a superficial parotidectomy have a facelift later in life?
Okay, so the parotid is a big salivary gland that we all have along this area, and apparently this person's had a superficial, so it has like a deep lobe, a superficial lobe, a deep lobe, and they had the superficial one removed. So they're asking if you can still have a facelift after that. The answer is yes. You got to go to someone who has a lot of experience. Of course, you got to let them know of the prior surgeries that you've had, but taking all that into account, they should be able to do it.
Multiple procedures done at the same time or separate? Tummy tuck, breast aug, BBL.
So I would separate it out this way, right? So I would do your tummy and breasts. You do that together. That's kind of our typical mommy makeover, and start with that. So tummy and breast together. Start with that. Then come back 3 months later and do your BBL. That's what's going to be the safest for you. It's going to decrease the amount of complications, decrease the risk of bleeding and needing blood transfusions, decrease the risk of infection, and most importantly, decrease the risk of blood clots. Okay, blood clots that can go to the lung and cause you to be in the ICU, in the hospital, or even death. That's why I don't like to do all those things together. Okay, so you'll do your mommy makeover first, so tummy and breast, and then come back 3 months later and do your BBL.
All right, a few more minutes left. I know you have to go, so let's
all right.
get to for BBL, do you remove fat from only the stomach or also from the back? Or would that have to be lipo 360 and BBL?
So all BBLs include lipo 360. All right, so whenever someone says BBL, you can just assume that it means liposculpture 360 plus fat transfer to the buttock and hips. It's basically the definition. BBL equals lipo 360 plus fat transfer to the buttock and hips.
After BBL, how many days do I need to call off work? I work in an office.
If you're in an office type setting, you probably only need about 7 to 10 days max to call off work. By that point, you should be able to do any office-based type of work, and also you should be able to be driving by then as well.
Is it possible to have a lift after a reduction and add silicone implants without actually going bigger?
Oof. So she's saying she had a reduction already, and now she wants to lift and implants and not go bigger.
Correct.
It's gonna be tough. It might be challenging. So remember, by definition, if you're adding an implant, you're adding volume. Okay. So if you're adding volume with an implant, you're gonna have to be able to reduce it in some other way. So you might actually need a secondary breast reduction with a lift, and then the implant placement to try to stay as similar as you can.
Can we get a tummy tuck and lipo at the same time, and how can we make the scar light after a tummy tuck?
So you can get some amount of lipo with your tummy tuck. And so what we typically do with our tummy tuck, especially our smart tuck here, is that we'll do liposuction all along the sides, right? So all along the flanks and the waist, this entire area, and including the axillary region through here as well. And so all that lipo can be done at the time of the tummy tuck, and we also can do some light, what we call ab etching or high definition as well. So we can do a little bit of high definition through here as well, so you can have that beautiful kind of curvy but enhanced natural athletic look. Okay, and then in terms of what was the second part of the question?
Ooh.
I know it was the lipo and
the scar. How do you?
Yeah, the scar. Great. So how to lighten up the scar? So yes, we do have to work on scars. Okay, but if you do, remember you have up to 12 months for that scar to become flatter, thinner, and lighter, okay? And the way to do that is to work with silicone-based scar creams. At least that's the initial way to do it. I like to use one called Silogen, all right? And then, of course, if you see any issues come up after that, sometimes they may require steroid treatments or potentially laser treatments, but really the go-to is the silicone-based scar treatment, such as Silogen.
Okay, 2 more questions.
All right.
How many incisions do you make with Lipo 360?
So I typically make 4 in the front, so 3 very, very low in that suprapubic area, 1 tucked inside the belly button, and then in the back only 2. So 1 kind of in between the butt cheeks there, and 1 around the bra line. Or sometimes if we're doing the South Beach kind of butt lift, I put 1, the low one, and then the other ones are tucked underneath the armpit on either side, so there's actually no marks, 0 marks all across the back.
Thank you. And last question, does the smart tuck, actually no, I asked that, sorry. Is Lipo 360 completed with ultrasound?
So the lipo part is not done with the ultrasound, right? So the part that's done with the ultrasound is the fat transfer portion of it. That's where all the problems are coming in, right? All the horror stories you may have heard, was that the fat was being injected into the buttock too deep, into the muscle. And from there, it was getting into these large vessels, traveling to the lungs and causing what's called a fat embolism, which can certainly lead to instant death, right? So that's why we use the ultrasound for that portion of it. The ultrasound allows me to turn a blind procedure to one where I can actually see, and I can make sure that I'm in that safe space between the skin and the muscle. I'm in that subcutaneous fat layer space between the skin and the muscle. And therefore, that is the safe space, and then the fat's not going to injure, the cannula and the fat's not going to injure any vessels, okay? But it's not necessary for the actual liposuction part of the procedure. That it's really mostly has to do with the surgeon's experience and how many liposuction procedures they've done and how safe that surgeon is.
Thank you very much.
Okay, all right. Awesome. Well, I think everybody got some good information here.
Yes.
Remember, you're coming from out of town, just go to our website. We'll get started there, and then we'll have our coordinators reach out to you, and they can coordinate everything else. Okay. All right. Well, I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. Take care, everybody.